We ready to roll? Is everybody ready? All right. Good morning, everyone. First of all, I just wanted to start off by addressing the difficult news of the fire that occurred last night at the Chez Nous facility in Wellington. Thankfully, the 48 residents and staff were safely removed from the facility, and we are most grateful and thankful for that. And for the first responders, the firefighters from 3 communities, the Red Cross, and the dozens of community volunteers who assisted, thank you very much. On behalf of all Islanders, I want to thank all of those who assisted last night. I believe it's a further demonstration of the strong sense of community and kindness that is felt throughout Prince Edward Island, and just another example of why this province is the best place to live, work, and raise a family. I was in contact this morning with the MLA for the area and the leader of the third party, Sonny Gallant, to express our appreciation and thanks to all of those for those efforts, and as well to offer all of the support necessary in the days ahead to assist the residents, their families, and staff as we work our way through this most difficult situation. Before Dr. Morrison and Chief Nurse Downing provide their weekly updates, I believe I'd just like to take a second to remind Islanders, even though I know we are grateful for this current situation we're in, but just to remind everybody just how fortunate we are to be where we're at, how rare it is for a province or jurisdiction to enjoy the level of openness we have here in this time of a worldwide health pandemic. In fact, at a time when other jurisdictions are experiencing tightening restrictions and increased lockdowns, we are in the very fortunate and enviable situation to be looking in the days ahead to see a further, albeit slower, easing of some restrictions within our borders. In the days ahead, providing we're able to maintain our current level of trajectory, we are hopeful to see a further minor expansion in public health gatherings, some expansion of occupancy and hours of operation in the hospitality sector, as well as some other minor adjustments. And that's just a further indication of the great job Islanders have done in this situation and how fortunate we are to be here. Lastly, for me, the continuing interest for many is the reconnection with the Atlantic region, the Atlantic bubble. At this time as a province, we are not comfortable moving forward with re-entering the Atlantic bubble. We will continue to monitor this situation from a regional perspective at the Premier's level as well as with our CPHO officials in all 4 regions. But until we can see a dramatic reduction in the new COVID cases within the region, we will maintain in Prince Edward Island the requirement to isolate for a 14-day period for all of those entering our province. So with that, I will turn it over to Dr. Morrison for her daily brief first.
Thank you, Premier. Good morning. And I know I end the briefing today by talking about how grateful I am, but I'd like to also start as well by saying I'm grateful to be here in PEI and for how we have managed together this COVID in PEI in the midst of a global pandemic. I know it hasn't been easy, but we are taking step by step together and moving through it. Today, there are 2 new cases of COVID-19 to report. One is a female in her 40s, and she is a contact of a previous case. The other case is a female in her 20s who recently traveled outside of Atlantic, Canada. Both of these individuals are self-isolating and contact tracing is underway. We currently have 7 active cases. They are isolating at home and public health is following them daily. Since the pandemic began, we've had 110 cases of COVID-19 with no hospitalizations or deaths. Globally, there are almost 94 million cases and over 2 million deaths. The United States has reported almost 24 million cases and 400,000 deaths related to COVID-19. It's predicted there could be an additional 100,000 deaths in the United States within the next month. The situation in Canada remains concerning, with over 715,000 cases and 18,000 COVID-related deaths. Since January 1st, New Brunswick reported 372 new cases, Nova Scotia 60 new cases, PEI has had 12 since January 1st, and Newfoundland and Labrador reported 6 new infections. During the past week in Canada, hospitalizations were up 15% and ICU admissions up 13%. Ontario has declared a second provincial state of emergency and added new enforcement measures, including a stay-at-home order until at least February 11th. Our friends and neighbors in New Brunswick are working hard to contain the spread of COVID-19, reporting 89 new cases in the past 3 days. They currently have over 300 active cases, the most since the pandemic began. One region in New Brunswick is now in the red alert level, with all other regions in the orange level. We have tremendous empathy and understanding for our colleagues in New Brunswick. While they are struggling to break the chain of transmission of COVID-19 in their province, we know that we could easily be in a similar situation, and we know from past experience that one phone call from the provincial lab about a case who is not self-isolated or has no history of recent travel certainly can change our circumstances very quickly. In light of the resurgence of COVID-19, the World Health Organization has warned that jurisdictions around the world need to work harder and recommit to stopping the spread of this virus. And they highlight 3 conditions that are making it easier for COVID-19 to get a stronghold. First is the incidence of COVID-19 is escalating around the world, and we are experiencing that firsthand in Canada and the United States. Secondly, the virus is evolving, with a number of variants and mutations emerging that appear to increase the transmissibility of COVID-19, and that there is a trend towards less adherence towards public health measures around the world, or in other words, the virus is taking advantage of our fatigue. As I've said before, we must remain vigilant here in PEI and not let our guard down against COVID-19. While many Canadians are functioning under strict public health measures, in PEI we are in the fortunate situation, as the Premier mentioned, of gradually easing back to a new normal. Until January 25th, we are in the post-circuit breaker phase, and we will continue to take the next few days to assess the trends in epidemiology in Atlantic Canada in order to make our decision regarding our way forward in PEI. Given the evolving COVID-19 situation in other provinces, information regarding the further easing of measures to come into effect in PEI next week will be announced later in the week. Given the context in the region, we do not anticipate reestablishing our participation in the Atlantic bubble before mid-February. We are on track with our plan to vaccinate frontline healthcare workers involved in the COVID-19 response and long-term care and community care residents and staff across the province. As of yesterday, 5,910 doses of the COVID-19 vaccine have been administered, including 1,407 second doses, and that means over 4,500 individuals have been vaccinated. By the end of this week, everyone living and working in long-term care and community care facilities will have received their first dose of the vaccine, and they will start receiving their second dose next week. And receiving that second dose of vaccine is essential to achieve that full immunity. By February 16th, all long-term care and community care residents and staff will be fully immunized against COVID-19. And it will be a really good milestone on our COVID journey and a relief when this group is immunized and protected against COVID-19. As soon as everyone in the long-term care and community care sectors is immunized, our focus will turn to vaccinating others in congregate living situations, including group homes, community residential facilities, shelters, and other priority groups, including Indigenous adults and other healthcare workers. By the end of March, we anticipate that everyone living and working in long-term care and community care and other congregate living arrangements, as well as many healthcare workers who provide direct patient care, will be fully vaccinated. We actually plan to expedite the process to immunize certain high-risk groups before the end of March, starting with those over 80 years of age living in the community and registered rotational workers and truck drivers. Beginning in early February, these individuals will be able to book appointments for clinics that will start in late February, early March. In the months ahead, Islanders will be advised about the location of these public vaccine clinics and how to schedule appointments. And please be patient. I know it will take months to immunize all Islanders, and there will be vaccine for everyone. We do know the most significant risk factors for poor outcomes related to COVID-19 are age and those living in congregate living settings. Over 96% of COVID-19 related deaths in Canada are in individuals over the age of 60. And 71% of our hospitalizations are also in that same age group. The very best approach for our province is to target vaccine based on age, beginning with the oldest Islanders and working our way down the continuum, and that is why we will begin with individuals over the age of 80. Everybody is important. All Islanders are important, and that's long-term care residents, staff, healthcare workers, teachers, those with immunocompromising conditions, and those who look after people with immunocompromising conditions. There have been media reports about a temporary production slowdown of the Pfizer product that will reduce the supply of vaccine available in Canada. The impact of this reduction in PI will be minimal and will not affect our objective to have everyone in long-term care and community care fully immunized by February 16th. The Pfizer slowdown means that we may not get a shipment of the product for 1 week on January 25th, and that shipment contains 975 doses. However, we will get 2 shipments of that same amount in middle of February, so it really evens out. And given the fact that we've been holding back a second dose of vaccine, we expect to have that increased supply in February. We are confident that we have enough vaccine to continue with our original plan. The fact that we have held back some second doses has given us the flexibility to adjust and accommodate missing a single shipment of the Pfizer vaccine. The COVID-19 vaccine is an important tool to help stop the pandemic and provides an important layer of protection against the virus. I think we have a good plan as we roll it out based on the limited vaccine we have. We know more vaccine is coming, and we actually have more vaccines that are being looked at for approval in this country and around the world. Until we learn more about the protection offered by the vaccine, we will continue to protect ourselves and others by using all the public health tools available, including physical distancing, washing our hands often, and wearing a mask in public places. Although I mentioned testing, self-isolation, and contact tracing at most briefings, I'd like to take a few minutes to remind everyone how important these measures are to our provincial COVID-19 response. The foundation of our public health response is to isolate potential cases, diagnose cases early, conduct comprehensive contact tracing, and quarantine close contacts and confirmed cases. And of course, the only way we can really identify cases is by testing. In the past week, the provincial lab processed 3,011 COVID-19 tests. And I urge all Islanders with symptoms, even mild ones, to get tested for COVID-19. And I know 10 months in, I still need to talk about isolation. Self-isolation is the bedrock of our ability to contain transmission of COVID-19, helping to prevent the spread of the virus. And I am aware that there are people in PI who do not want to follow self-isolation rules and may have chosen to put themselves and others at risk by not following these rules. When advised to self-isolate or work isolate, you are required to follow the rules. People returning to PI from out-of-province travel, people diagnosed with COVID-19 and their close contacts are among those who are legally required to isolate. Individuals who are not following isolation have led to additional cases over the last months in this province, and this has put pressure on our system, including testing, contact tracing, and follow-up, and it has most importantly put others at risk. Individuals diagnosed with COVID-19 are legally obligated to cooperate with public health officials and provide complete information about their activities and close contacts. Failure to do so can result in a charge with obstructing a public health official. Getting through this pandemic is challenging for everyone, and we all want it to be over. It has been 10 months since the pandemic was declared. We are tired and know the months ahead will continue to be challenging. As Dr. Tam noted last week, the end of the race is always the hardest, but we will not be in this situation forever. There is light at the end of the tunnel. We are very grateful to have access to a timely, safe, and effective vaccine much earlier than most would have predicted, and our vaccine rollout is underway and is going well. As the Premier mentioned, we can be grateful to live in PEI, where to date we've been able to meet the challenges presented to us by COVID-19. We can be grateful that we are able to do most of the things we could do prior to the pandemic with some modifications, and the resilience and sacrifices of Islanders are paying off. We do have to recommit to being vigilant and continuing to work together to prevent importation and transmission of COVID-19. We really have to stick together and follow these measures and support one another. While we know the end of the race is within sight, albeit a ways off, let us continue to be patient and let us continue to be kind. Thank you.
Good morning, everyone. I'd like to just begin by saying our thoughts and are with the residents and staff and families of Cheynou and Wellington, and offer our thanks to those first responders and volunteers who've been assisting these Islanders in this emergency situation. I'd start my update this morning by recognizing those individuals who have tested positive for COVID-19 and their close contacts for doing the right things, following those public health measures, getting tested and self-isolating. We know this is not easy, but as a province and as a health system, our ability to keep numbers of COVID-19 low and maintain the health services we have is tied to everyone doing their part and continuing to follow those public health measures. This is what allows us the freedom to do things like visiting with our small circles, seeing loved ones in long-term care under proper restrictions, and even enjoying an active lifestyle with sports and functioning gyms and operating restaurants. I know that many Islanders and the rest of our healthcare workers are anxiously awaiting the time when they will receive the vaccine, and I want to thank our public health nursing who've been working with Dr. Morrison's office in coordinating the vaccine rollout, which is ongoing. Our system is prepared and are ready to provide immunization to Islanders as the supply of vaccine continues to arrive. While many things about COVID-19 are new to us, delivering vaccines is something the health system on PEI is very experienced with, and we do have the proper staffing and expertise to continue to coordinate this rollout, including those relationships with our community partners who will help us in the future as the general public receives vaccine when our supply increases. We do continue to be busy at the COVID-19 testing clinics, and testing remains an important step to limiting the spread of the virus. Anyone with symptoms is encouraged to get a test at one of our 5 sites across PEI. I want to remind Islanders who require testing before leaving the country for international travel that the process to get results for this purpose does take several days, up to 5 days. Please plan ahead with your travel as to not delay your scheduled flights or travel plans. And as we know, only essential travel is recommended at this time. For those visiting our Health PEI hospitals and clinics and services, please remember to wear your mask at all times, physical distance 2 meters when possible, and follow the specific directions in the units and sites you are visiting. While there are general visiting guidelines that make our facilities among the most accessible in Canada currently, individual units and sites do have specific parameters because of restricted spaces that must be followed in order to protect everyone. Please remember to continue to seek health care if you need it. Bring and wear a mask as you enter our services, and please go and be tested if you have any symptoms of COVID-19. Thank you.
Thank you both very much. Now we will open up the line to some questions from our friends in the media.
Gabrielle Trumont, Radio-Canada.
Good afternoon to you all. Bonjour, Dr. Morrison. Ma question, c'est une question en français. Est-ce que vous pouvez, s'il vous plaît, répéter brièvement l'annonce que vous avez faite aujourd'hui en français?
OK, bonjour. Il y a deux nouveaux cas de COVID-19 à annoncer aujourd'hui. Il s'agit d'une femme dans la quarantaine qui est en contact d'un cas déjà annoncé. Le deuxième cas est une femme dans la vingtaine qui a récemment voyagé à l'extérieur de la région atlantique. Ces deux personnes sont en auto-isolement et la recherche des contacts est en cours. Alors, on a actuellement 7 cas actifs et les personnes sont en auto-isolement. Et puis, jusqu'au 25 janvier, nous sommes en phase post-coupe-circuit. Alors, on va annoncer peut-être des changements additionnels, mais avant le 25. Mais étant donné la situation en évolution de la COVID-19 dans la région, j'imagine qu'on ne va pas participer aux boules atlantiques avant le mi-février. Et aussi avec les vaccins, en date d'hier, 5 910 doses de vaccins contre la COVID-19 ont été administrées. Et puis, y compris 1407 deuxièmes doses. Et puis, d'ici la fin de cette semaine, toutes les personnes qui vivent et qui travaillent dans les établissements de soins de longue durée et de soins communautaires auront reçu leur première dose de vaccin. Et ces personnes commenceront à recevoir la deuxième dose la semaine prochaine. Peut-être je vais laisser là. Mais je pense que ça, c'était les choses en particulier.
OK, parfait. Mais merci beaucoup. Ma deuxième question, comme avait mentionné le Premier ministre Denis King hier soir, il y a eu l'incendie à la résidence pour personnes âgées, le chez nous à Wellington. Et on sait que tous les résidents de cette résidence ont dû être déplacés dans un hôtel pour l'instant. Mais de quelle façon ces événements qui ont eu lieu hier pourraient changer le calendrier de vaccination des résidents du chez nous? Est-ce que vous avez déjà des informations à ce sujet à nous partager?
Je vais répondre en français puis aussi en anglais, mais on était supposé avec les infirmières de santé publique d'aller chez nous pour faire les vaccins aujourd'hui. Et puis à ce moment, ils sont à l'hôtel et on a décidé c'est pas une bonne journée, c'était d'aller. Et puis on est en train de discuter si on va aller demain, jeudi, vendredi, mais un autre jour cette semaine. C'est le plan d'en faire cette semaine quand c'est meilleur pour les résidents. So just in English, I was asked to first just to translate some of the key points from my message, but also the second question was about vaccinating the residents and staff at the Chez Nous. And it was initially scheduled to do the vaccinations there today. And we know that the residents have been, they're in a hotel setting, and we decided today is not a good day to do that. It's been very traumatic for the residents and staff, what they've been through, and we are discussing with them whether we should go tomorrow or the next day or another day this week. So they will be done, and it's just a matter of organizing another date later this week.
OK, parfait. Mais merci beaucoup. Bonne journée.
Carrie Campbell, CBC.
Good afternoon. Thank you. Dr. Morrison, you mentioned that there has been spread through people who were supposed to be self-isolating. I just wonder if you can provide any more details on that, how many cases we've had because of that, whether it's any of the cases that you've told us about or that we've heard about in the last couple of days. And I'm curious to know if the people who were supposed to be self-isolating, did they have a test result, and what was the result of that? Any more details you can tell us about this spread?
Hi, Carrie. So I think the comment is one that is important for really from the beginning of COVID. And some self-isolation is very difficult, and some of the spread would be from one person to another is based on perhaps a spouse not really being able to isolate away from a partner who has returned from travel. Or they've chosen to isolate together. So sometimes that has happened. And then there have been times where, and again, the numbers are not large, but times where someone may have not isolated the way that is required, and may have put others at risk. And so it's worth mentioning because I think it continues to be important. It will, and it does create a lot of stress for the system, but also for our community. And I think that's just a reminder to everyone as we get into COVID fatigue in every way, that isolation remains really important, and I think it's worth mentioning that.
Louise Martin, CBC.
Oh, sorry, I just had another question. I wasn't sure. I missed the end of Dr. Morrison there. Can I just add one more question?
Go ahead.
Dr. Morrison, I just wonder, though, if you could sort of characterize whether maybe there have been some of these cases where people were just trying but failing to self-isolate, or cases where you might characterize it as people ignoring the order to self-isolate. And also, with regards to what you said about the possibility of charges, has anyone been charged under any of these cases, and why or why not? Sorry for the delay in that.
Yeah, no problem. And I think maybe the answer to the first question is that I think there's been a little bit of both. Some people who have tried to self-isolate, and they haven't been able to, and so unintentionally spread COVID. And then other cases where, and again, it would be really not often, but that we may have had a case where someone unintentionally certainly spread COVID, but they didn't realize they had COVID, and but they did not follow the isolation requirements that are put in place, and that's why I know the Premier has talked about this before too, and I have. It's this virus is tricky. People don't feel sick, they don't look sick, and they can still spread the virus. So it's unintentional, but there's a reason that isolation is important to try to minimize that spread. In terms of charges, information is given to enforcement, and so I think we've had 77 charges with 3 pending. So that has been over the course of the pandemic, and those numbers are updated on a weekly basis.
Thank you very much.
Louise Martin, CBC.
Oh, hi, and good afternoon to all three of you. Thanks for taking our questions today. Dr. Morrison, we've learned that the 47 residents of Chez Nous, they're at Mill River, and they are able to stay there until Thursday. Then the hotel is booked up for the weekend. So in light of the fire, in light of the COVID restrictions, will there any consideration be given for families to take their loved ones home? What considerations have been taken into account at the new location because of the pandemic? And, do they all have to stay together? What are sort of the rules around this unexpected, and frightening situation for these long-term care home residents?
Hi, Louise. I mean, and the Premier may be able to answer this as well, because I know, or Marion, everyone's been involved and aware of the situation. I mean, the first priority is the safety of the residents and the staff. And so I think they are discussing options for some families to take, to have the residents with them. And so I think where the residents are and making sure they're safe is really first and foremost. And if the residents go home with family before they're vaccinated, they will be vaccinated. Maybe not this week, but they will get vaccinated if that's part of the question. And of course, making sure the residents don't go home with family who are isolating or traveling outside the province would be important. And so those are just some of the basics, I think. I don't know if you want to add anything to that.
The only thing that I would add would be that we are working with the board and the management of this facility. Ministers Hudson and Aylward have been in contact with staff management, as has parts of their staff. So our goal right now, obviously, was to get them situated, to get them safely removed, to get them situated to a temporary location. Now we have to figure out how long that will be. So, the options in front of us would be a number have expressed interest to take some family members at home, which Dr. Morrison has just talked about. There are vacancies within the community care facility in various regions that would be options, but we're also working if we could secure a location on a temporary basis. So we've really offered all the help that is necessary along the way. We have to take our leadership and guidance from the board, but our priority is the residents, their families, and staff, and to get them through this. And we've made the commitment that we will be there. Just need to know what we need to help provide.
Okay, and sorry, I'll just go back to Dr. Morrison quickly then, just to be crystal clear before I go on to my question too, that family members are able, if they're not in a situation where they have to be self-isolating, that they can take their loved ones home given the fire at Chez Nous?
Yes, I mean, that would be really a decision with the families and the facility, and I mean that's would not really be a decision for me to take for any of us, but it's to make sure the residents are in a good place and are safe. So, yeah, I think I wouldn't have anything else to say about that.
I wasn't sure if the public health restrictions would prohibit that. And just one quick last question. The 4 new cases over the weekend, that information was not made public until late yesterday afternoon. And usually we would see a press release on the weekend. That information would come out pretty immediately. Is there a new policy holding off on releasing information, maybe a weekend policy or anything like that we need to be aware of?
Hi, Louise. I don't think it was a deliberate policy, but certainly, as you know, we've come out on the weekends when there's been any public exposures or needing to talk about any cases of concern. And when one case came in on Saturday and one case came in on Sunday, both having, with we thought we could wait until Monday, and then Monday early morning we had 2 additional ones. So it really is something that we know will continue to get cases, and we know there's an interest in having them go out as quickly as possible, and particularly important if there are public exposures or there are cases in areas in healthcare or education. For instance, so it was. I can assure you, I was working on the weekend, so it wasn't that I had the weekend off. So there wasn't a policy as such.
Goodness, that's not what I was suggesting. Thank you so much for your time.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. Good afternoon to everyone. Dr Morrison, il y a eu plusieurs études ces derniers jours ou dernières semaines qui disent que 10% des malades de la COVID ont des symptômes très longtemps après et continuent à avoir des symptômes. Je sais qu'on en a déjà parlé il y a quelques mois de ça. Est-ce que vous pouvez faire un point sur la centaine de malades à l'île du Prince-Édouard, s'il y en a certains qui sont concernés, s'il vous plaît?
Bonjour Laurent. On vient de discuter ça avec mon équipe ce matin parce qu'on est en train de faire une étude avec pour prise du sang pour l'immunité. Et puis, on a même discuté si on peut demander les cas positifs, si l'on a encore des symptômes ici à l'île du Prince-Édouard. Alors, on vient de discuter ça ce matin. Et si on peut faire ça au même temps, ce serait une bonne idée. Alors, j'ai pas beaucoup pour rapporter à propos des symptômes des cas qu'on a eu il y a quelques mois, mais c'est quelque chose qu'on va discuter et j'espère peut-être qu'on peut recevoir cette information en même temps qu'on fait l'autre partie de l'étude.
Merci. Et j'avais aussi une autre question sur les vaccins. Je vous ai déjà posé la question, je pense, en décembre. Là, il y a 1500 personnes, à peu près 1400 qui sont complètement vaccinées. Ces personnes-là doivent toujours suivre les consignes de santé publique et elles ne peuvent pas voyager comme elles veulent. C'est bien ça?
À ce moment, c'est ça. On a des cas qui continuent partout au monde et puis on ne sait pas vraiment la durée de la protection du vaccin. On ne sait pas si c'est, même si vous avez le vaccin, si tu peux même transmettre l'infection. Alors, on va apprendre de plus en plus dans les mois qui suivent, mais à ce moment, c'est pour tous les insulaires, on dit de ne pas voyager si ce n'est pas essentiel. Mais j'espère, Laurent, que ça va changer dans les mois qui suivent.
Merci beaucoup.
I'll just translate those questions because I'm reminded if I don't. One was, what do we know about ongoing sort of chronic symptoms with any ever positive cases of COVID-19? And we are in the midst of, we talked about it actually this morning with our team, and that we are doing a study of for immunity, and we'll be offering an immunity test to those who've had COVID-19 in the province. And we actually discussed this morning if we can use that opportunity to also check with people who have been positive in this province about any ongoing or lingering symptoms so that we can collect a little bit more information. So that we did discuss that this morning, and hopefully we'll be able to report back at some point in time. The other question was about for instance, the healthcare workers who've been fully vaccinated. Does that mean they can travel now that they're fully protected? And I mean, in this country and in this province, travel for non-essential reasons is not recommended, and we still are going to learn more about how long the vaccine is effective for, and which still remains unknown at this point in time, but there'll be more information that comes, and also about the asymptomatic transmission, and I spoke about that last week a little bit. We still have lots to learn about the potential asymptomatic transmission, even in people who have been vaccinated. So I think we'll know an awful lot more in the months ahead, and I think we'll all look forward to being able to travel once we are vaccinated. But at this stage, there's no change in the recommendations in terms of those public health measures.
Dave Stewart, The Guardian.
Good afternoon, folks. I guess first I'll ask, you talked to Dr. Morrison about the virus evolving. I'm just wondering if it affects the efficacy of the vaccines.
Hi, Dave. So at this point, what they have looked at is that the vaccine that we are using seems to be effective against the strains of virus that are circulating. They are looking at it closely and will continue to monitor it in terms of the vaccine effectiveness and the different strains. At this point, everything is reassuring, but there's a lot of people paying a lot of attention to exactly that around the world. But at this point, I'm confident in the vaccine, but it does speak to why we as a country are concerned about the introduction of large numbers of cases of the new variants into the country.
Okay, thank you for that. I've also heard that there's a third vaccine, I guess, being used over in Britain, and I guess in the interests of vaccinating as many people as quickly as we can. Has there been any talk that you know of from Health Canada about purchasing that third vaccine?
Yes, Canada has already entered into agreements with a number of vaccine companies other than Pfizer and Moderna, and will be reviewing a number of vaccines, more than one in the weeks ahead, and that's why we are anticipating and hopeful that we will have additional vaccines that Canada's already entered into agreements with if they're approved and available for use in this country.
Great. Thank you very much.
You're welcome. Thank you.
Thank you, Dave. I think that wraps us up today, so thank you both as well, and to Island, stay safe.